Welcome to Chapter 2 of Essentials of Healthcare Finance. This chapter explains how healthcare providers paid for services rendered. In other words, how do healthcare providers generate revenue? First, the chapter covers the healthcare revenue cycle. The revenue cycle is broken down further into the components that ultimately lead to timely and accurate payment for products and services provided to patients. Coding and billing are two core aspects of proper reimbursement in healthcare. Topics covered in this chapter will be healthcare claims, registration, medical record coding, charge entry, charge master, billing and claims preparation, and claims editing. The objectives of this chapter are to describe the revenue cycle for healthcare firms, understand the role of coding information in healthcare organizations in claim generation, define the basic characteristics of charge masters, define the two major bill types used in healthcare, and appreciate the role of claims editing in the bill submission process. There are 6 stages to the revenue cycle in healthcare, which are as follows: provide services, document services, establish charges, prepare the claim, submit the claim to the payer, and receive payment. The key to accurate and timely payment is documentation. The first step in a revenue generation typically is the occurrence of an encounter with the patient. Then when a patient presents to a provider, the first part of the documentation is basic information about the patient, such as name, address, and insurance status. This process is known as registration. The major revenue cycle steps are registration, medical record and coding, charge entry, charge master, billing and claims preparation, and claims editing. As I briefly mentioned in a couple slides back, the very first step in revenue generation is the occurrence of an encounter with a patient. And when the patient presents to the provider, the first part of the documentation that's received is the patient's name, address, and insurance status. This gets back to registration. So there are 3 key activities of registration: insurance verification, computation of patient's copayment or deductible, and the financial counseling for the patient's portion of the bill. We'll want to make sure when you're verifying insurance to get the patient's health plan ID number, as well as look for the network logo on the card so that you can make sure that the insurance that you are taking into the system and entering into the system matches with the network of the contractual that's also loaded in the system. From there, you'll be able to accurately calculate, based on the service that they're coming in for, whether it's applying to their deductible or if it meets the standards for copayment, and you'll be able to collect the right amount. Financial counseling is part of the registration process for patients who do not have insurance coverage or who are unable to pay their copayment or deductible amount. You may offer them financing. There's companies out there like Care Credit or Affirm that can help finance some of the costs for healthcare services, or help them with a referral to apply for Medicaid or other governmental programs. Documentation of the services provided is the next key element of revenue generation. In nearly all cases, if a product or service is not supported by documentation, it cannot be billed. Coding is the bridge between medical records and the administrative billing systems. Coding is what allows the medical record to be utilized for billing purposes. Coding enables payment of charges submitted for reimbursement and provides statistical data for the firm's financial planning. The Health Insurance Portability and Accountability Act, otherwise known as HIPAA, of 1996, provides the basis for the present state of medical coding. There are 2 systems: the International Classification of Diseases, commonly referred to as Icd-10, referencing the 10th revision, the clinical modification. So you'll see it as Icd-10 CM. and the Healthcare Common Procedure Coding System, or HCPCS. Table 2.1 in your book will explain under what circumstances each type of system is used. HCPCS is also where the CPT codes come from, which are current procedural terminology. The ICD-10 codes are diagnosis codes, and they are comprised of 3 to 7 digits, which provide greater specificity at the 6th and 7th character level. Procedure codes are used to report inpatient procedures. So diagnosis and procedure codes are used for DRG, Diagnosis Related Group Assignment, which is often used to determine payment. HCPCS codes are used by physicians for reporting both inpatient and outpatient procedures. They're used by facilities for reporting outpatient procedures as well. And there are 2 tiers. There's level 1, which are the current procedural terminology, or CPT, that I had mentioned, which is a 5-digit code, and they're maintained by the American Medical Association. And level 2 HCPCS codes. Level 2 HCPCS codes are going to be used for classifying services or supplies that are not found in the CPT system. They're also called national codes. And these 5-digit codes are structured alphanumerically and range from A to V. There are 6 main categories of level 1 CPT codes. The first is the evaluation and management, often referred to as E&M codes. These are the codes that are used for office visits and consultations at different levels of complexity. There's also anesthesia, surgery, radiology, pathology and lab, and medicine. Each of these sections, each of these categories are defined numerically. For instance, the E&M codes start with 9. The surgery codes typically start with 1. Radiology typically starts with 7, and so on. So they may contain modifiers as well that provides additional information that are essential to the claim. A modifier is simply a 2-digit code that goes in addition to the CPT code, and it lets the payer know whether there was additional services provided, or if there were less services provided, or if there were multiple services provided. There's many categories of modifiers. The level 2 HCPCS codes are used to report products, services, and supplies, materials, or procedures that are not present in the level 1 CPT code. They are 5-digit codes that begin with an alphabetic character followed by 4 numeric characters. There are 2 groups of codes, permanent and temporary. Permanent codes are, as the name states, permanent. An example may be non-ionic contrast for a CT scan. When the CPT code for a CT with contrast automatically includes ionic contrast, if they're using non-ionic contrast, they may use an A code for the HCPCS code to bill an additional amount for the non-ionic contrast that's being used that is not part of the 5-digit CPT code. Temporary codes are used for needs that are not covered by permanent codes, and they can remain temporary indefinitely, which is interesting, and is sometimes then replaced by a permanent code. The charge entry function represents the quote-unquote capture of products and services that are provided. The 3 greatest concerns in billing are the capture of charges for services performed, incorrect billing, and billing late, or billing late charges. The charge capture methods are charge slips that are posted in a batch process, meaning all the charges are entered at one time, or an order entry system where each charge is entered in separately. Charge explosion can be used when a uniform set of supplies is used. The charge master has long been a critical element in the coding, billing, and payment process of hospitals and health systems. The charge master's primary function is to be the computerized repository of the charges and coding information that are used to develop claims. In addition, the charge master is increasingly being used to track utilization of supplies and services, which can then be analyzed by management for efficiency of resource use. Every charge master will usually have the following 6 common elements: charge code, the item description, department number, the charge or price, the revenue code, and the CPT/HCPCS code. In this example of a charge master extract, you can see the item code that is given to the item description, the department number for which it pertains, what the standard price is, the revenue code that is associated with it, and whether or not there's a HCPCS code or a CPT code, which is what you're looking at there, that goes along with it. Generation and submission of a hospital bill are the mechanisms by which hospitals request reimbursement for services provided. Billing forms are necessary for consistency in the information required to provide reimbursement for services provided. There are 2 major billing forms that are currently used to obtain reimbursement: the Uniform Billing Form 2004, referred to as the UB04, and CMS Form number 1500, referred to as CMS 1500. Reimbursement of inpatient and outpatient hospital care is obtained through submission of the UB04. Non-hospital services, such as in-hospital physician services or private physician office visits, they require the CMS 1500. Most claims in today's environment are submitted in an electronic format. Usually claims are submitted directly to the payer or indirectly to a clearinghouse where the claims are grouped and then sent to the appropriate payer. The HIPAA administrative simplification provisions direct that the Secretary of Health and Human Services adopt standards for administrative transactions, code sets, and identifiers, as well as standards for protecting the security and privacy of health data. Most providers now use some form of claim editing software in order to ensure that a claim is accurate and complete. Claim editing software uses rules-based logic to assess provider claims information, including CPT and HCPCS procedure codes, against a series of edits using a clinically based software system that evaluates claim information to detect coding irregularities, conflicts, or errors. CMS developed the National Correct Coding Initiative, or the NCCI, to promote national correct coding methodologies and to control improper coding that leads to inappropriate payment of Part B health insurance claims. The coding policies developed are based on coding conventions defined in the AMA's CPT codes, national and local policies and edits, coding guidelines developed by national societies, analysis of standard medical and surgical practice, and review of correct coding practice. CMS has designated a series of specific edit checks that are used in determining hospital outpatient claim status. These edit checks are referred to as Outpatient Code Edits, or OCE. The OCE utilizes claim level and line item level information in the editing process. The claim level information includes such data elements as from and through dates, Icd-10 diagnosis codes, type of bill, age, sex, etc. The line level information includes such data elements as HCPCS code with up to 2 modifiers, a revenue code, SUs, etc. Each OCE edit results in one of 6 dispositions. Claim level dispositions are rejected, claim must be corrected and submitted; denied, claim cannot be resubmitted but can be appealed; return to provider, there's problems that must be corrected and the claim must be resubmitted; or suspension, claim requires further information before it can be processed. There's also a line item level disposition, a rejection where the claim is processed but the line item is rejected and can be resubmitted later. A denial where the claim is processed but the line item is rejected and cannot be resubmitted. In summary, the revenue cycle is the financial lifeblood of any organization. In healthcare, accurate and timely billing and coding are essential to the financial success of healthcare providers. The complexity of the healthcare industry has resulted in an equally complex process for billing of healthcare services. In healthcare firms, the charge codes describing the services or products must be related to a standard procedure code and supplemented with diagnosis codes to document the legitimacy of the services. These codes can and do have a major role in not only the amount of payment received, but also the timeliness of that payment. Claims editing software is widely used by healthcare providers to ensure the accuracy of their claims prior to submission. Billing and coding are so important that these functions often report directly to the Chief Financial Officer. Yet, this highly complex area requires specialized knowledge, and a firm should hire and train coding and billing professionals. Mastering this process requires intense training and ongoing education. To ensure appropriateness, government agencies have developed numerous standards for billing, coding, and documentation of medical care. Billing errors may have significant ramifications because they can be classified as fraud under the False Claims Act. For all of these reasons, it is essential that the healthcare manager and executive be well schooled in the importance of billing and coding.